For decades, you've heard me talking about the unbelievable advances in science coming down the pipeline, leading to treatments and cures for so many disease processes and symptoms. We've had so many breakthroughs in the 30 years I've been in the medical field, but now things are really getting exciting. Today, we're talking about Alzheimer's disease. Something extraordinary has just happened in Alzheimer's research. Until now, scientists could only treat symptoms of dementia. But for the first time in history, we now have treatments that can actually slow the disease process itself, and they are now being used in clinical practice. What's even more exciting is what's coming next. We're entering an entirely new era of brain medicine. Alzheimer's disease is the most common cause of dementia. It's a progressive brain disorder that slowly damages memory, thinking, and eventually the ability to carry out daily life. But for years, doctors could see the symptoms without fully understanding the biological process happening inside the brain. In Alzheimer's disease, two abnormal proteins build up in the brain. The first is called amyloid. Amyloid forms sticky plaques that accumulate between brain cells, interfering with how those cells communicate. The second protein is called tau. Tau normally helps support the internal structure of brain cells, but in Alzheimer's disease, it becomes twisted and forms tangles inside the cells themselves. So in simple terms, amyloid clogs the space between brain cells. Tau damages the cells from the inside. Over time, this combination disrupts communication between neurons and eventually leads to cell death. Interestingly, amyloid itself is not something the brain should never make. Your brain actually produces amyloid naturally as a byproduct of normal protein metabolism. Under healthy conditions, the brain clears it away. But with aging, genetics, inflammation, and vascular disease, the brain's ability to clear amyloid can become impaired. When production and clearance become imbalanced, amyloid begins to accumulate and form plaques. For decades, Alzheimer's medications focused mainly on symptoms. They could help support memory temporarily, but they didn't change the underlying disease process. That's why Alzheimer's research felt stuck for so long. That changed recently. Scientists developed new antibody therapies designed to help the immune system actually remove amyloid plaques from the brain. These treatments don't cure Alzheimer's, but clinical trials show they can slow the progression of the disease in some patients. That's incredibly important, because it proves that targeting the biology of Alzheimer's can actually change the course of the disease. At the same time, another major breakthrough is happening. We can now detect Alzheimer's-related protein changes years before symptoms begin. New blood tests can identify early markers of amyloid and tau buildup long before memory loss becomes obvious. This means that in the future, we may be able to identify people at risk and intervene much earlier. And what's coming next may be even more exciting. Researchers are currently testing Alzheimer's vaccines that train the immune system to clear harmful proteins, gene therapy that may protect vulnerable brain cells, and combination therapies that attack multiple parts of the disease at once. Right now, there are more than 180 clinical trials underway, exploring new ways to slow, stop, or even prevent Alzheimer's disease. Why is this such a big deal? Alzheimer's disease affects tens of millions of people worldwide. It's one of the most emotionally devastating diseases for families, and one of the most expensive conditions for healthcare systems, nursing homes, and hospitals. If scientists succeed in slowing or preventing this disease, the implications could be enormous for patients, families, and society as a whole. 20 years ago, Alzheimer's research was stuck. Today, we're entering an entirely new era of brain medicine. If you enjoy learning about breakthroughs in medicine, science, biology, and how the brain actually works, I share many more videos like this at education-drchristineblakesmith.com. I'd love to have you join me there.